name is Sarah Byrne, and I'm a community engagement specialist with the City of Somerville. Today, I'll be sharing with you the first of what will be regular situational updates about the current state of the vaccine rollout in Massachusetts. The information in this presentation is current as of February 5th, 2021. As of today, Massachusetts is in Phase 2A of its vaccination timeline. That means that the currently eligible groups include all healthcare workers, first responders, as well as staff and residents of long-term care facilities, congregate care settings, and everyone who is 75 years of age or older. The next group in line will include people who are 65 years or older, people with 2 or more comorbidities, which are medical conditions putting them at increased risk for severe illness from COVID-19, and residents and staff of low income and affordable senior housing. We expect that this next group will become eligible sometime in February or March. So you might be wondering, what counts as a comorbidity? The Massachusetts Department of Health has decided to use the list of the following conditions, which was provided by the CDC. This is a list of conditions that put people at increased risk of severe illness from COVID-19, and these conditions make you eligible for a vaccine in Phase 2 of the Massachusetts rollout. So if you have 2 or more of these conditions, then you will be in the next group to become eligible. And if you have 1, you will become eligible later on in Phase 2. These conditions include cancer, chronic kidney disease, chronic obstructive pulmonary disease, Down syndrome, certain heart conditions, immunocompromised state, obesity, severe obesity, pregnancy, sickle cell disease, smoking, and type 2 diabetes. To give you a sense of where we are in the rollout, the graph on the right shows the number of vaccine doses that have been administered by date. You can see that number has been growing over time, and we expect that number to continue to grow. This will mean that it will become easier to get an appointment, and waiting times will be decreased over time. So as of the most recent weekly report from the Massachusetts Department of Health, which was on February 4th, 2021, the state had administered 681,472 total doses and had received 896,300 doses. According to the most recent data from the CDC, 7.5% of Massachusetts residents have received at least 1 dose, and 1.9% of Massachusetts residents have received both doses and are fully vaccinated. As you can see here, the largest age group to have been vaccinated is the 50 to 69 years old demographic, with the second largest being the 30 to 49 years old age demographic. But currently the fastest growing groups are the 50 to 69 years old and the 70 plus years old groups. Here you can see the cumulative vaccine doses that have been administered by practice type. So the most common setting by far for someone to have received a vaccine dose is through a hospital, with the second most common setting being a pharmacy, either through retail or through the federal government's partnership to provide vaccines directly to residents of long-term care facilities through pharmacies. And the third most common setting is your local Board of Health and Health Department, like the one here in the City of Somerville. To learn more, you can visit somervillema.gov/COVID vaccine. While you're there, make sure that you also sign up for city alerts via email, text, and phone call so that you can stay up to date on all the latest information. In addition to that, we are now offering call-in lines where you can listen to a pre-recorded message with the latest information in 5 different languages. These are the numbers for the call-in lines in English, Spanish, Haitian Creole, Portuguese, and Nepali. Thanks, and I'll see you next week.